living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
You're not alone if you've experienced back pain at some point. In fact, about 80% of adults will experience back pain in their lives. So what can you do to avoid it or lessen the pain and stay spine healthy? You won't want to miss this week's show because we're going to focus on back and spine health. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Lisa Sather. Stay tuned. Welcome back to Healthy Living for Life. Our first guest is Trapper Hogberg, who specializes in orthopedic spine surgery. Welcome to our show, Trapper.
Thanks for having me.
Thank you. So can you start by giving us a breakdown of the different bones and tissues that make up the spine?
Sure. Well, the vertebrae, or the back, is made up of 30 separate bones, and they're all kind of stacked on top of each other, and they connect our pelvic girdle to our head. In between each one of these vertebrae are vertebral discs, which act as soft cushions that kind of cushion the bones, keep them from rubbing against each other. And then there's a bunch of tissues and ligaments that kind of connect everything together.
Perfect. So I know lower back pain is a common problem for adults, and especially for those over the age of 50. So what happens as we get older that leads to the propensity towards that?
Well, as we get older, the discs tend to degenerate over time. You lose a lot of moisture in them. They get quite dehydrated. And over time, these shrink down and cause the bones to start rubbing against each other. And this can start to give you early arthritis in the back or deterioration, causing quite a bit of back pain.
Mm-hmm. And so how about talking about why the lower back is usually a more common area where people have spine pain than other areas?
Yeah, the lower back is what carries most of the weight from our upper body. If you look at all of our upper mass goes through the lower back, and that's where most of the weight is distributed on our lower back. There's a lot of movement in this area as well, and tends to be a higher area of friction, which can cause more pain over time.
Makes complete sense. And I've heard, people talk about losing height or shrinking as they get older. What makes this happen to folks?
Yeah, like we talked about, the discs are actually, when we're younger, nice pliable shock absorbers, and as we get older, they lose quite a bit of moisture, which causes these discs to shrink down. And that, with the bones now rubbing on top of each other, will actually shrink down over time. It's not uncommon for an adult in their 70s to lose 2 inches of height.
Wow, that's amazing. So how about people that are overweight? Are they more likely to experience back pain?
Absolutely. The more weight that you have in your upper body, the more pressure is generated on that lower back, which can cause excessive pain. And especially having more mass in the front, it kind of changes the way your posture is. It causes you to lean forward more. And not only does it place more stress on the spine and the bones, but also on the muscles as well, trying to hold your posture upright.
That makes sense. So for those of us who sit at a desk a lot and maybe tend toward poor posture, is that something that can lead to back problems? Absolutely.
Poor posture is one of the leading causes of back pain for sedentary people. The leaning forward throughout the day with poor posture causes the muscles to kind of not do their job. It can also cause the vertebrae to not align in the way that they should. I often find myself slouching and needing to take constant breaks just because of this.
So sitting for long periods of time, you'd recommend doing just that then?
Yes, frequent breaks, stretching, standing up, changing positions, and also kind of trying to concentrate on the posture will help.
That makes sense. So how about wearing shoes that don't quite fit right or that are worn down? We hear about that. Is that an issue for causing back pain?
Absolutely. A lot of back pain can be caused from ill-fitting shoes, especially in the summertime. Flip-flops don't offer you the cushion or the amount of, nice cushion that you get with them. It tends to put more pressure on the back. It can also adjust the way that you walk. I always say that if you build a foundation crooked, the rest of your house is going to go up crooked as well. So good fitting shoes with good padding can certainly help alleviate some back pain. If you notice that you're having back pain and you say, hey, I just got this new pair of shoes, maybe try switching up the shoes and see if the back pain goes away.
That's good advice. So what about insoles? You know, buying special insoles or arch supports for shoes, is that recommended?
Absolutely. Insoles, again, offer that nice amount of cushion that can alleviate some of the shock. And then insoles can actually help the way we distribute weight on our feet. These can also help out with our posture and the way that we stand. You know, if you are noticing that you're having back pain and foot pain, or you've recently changed shoes, you can always go see your podiatrist or your physician and see if you guys can figure out if that's a common cause.
That's great advice. So we've talked about sitting for long periods of time. What about standing for long periods of time? You know, standing stationary, just standing, is that an issue for back pain?
Absolutely. That's all the weight that you have being placed on that lower back. Standing for long periods of time, much like sitting, especially workers that are working with their hands bent over, slouching as they're sitting, that can cause quite a bit of pain as well. Well-fitting shoes can also help out with this as well. Some of the harder shoes can certainly not absorb as much shock and place quite a bit more pressure on the back.
So I'd assume same recommendation goes with sitting for long periods of time. If you're just going to be standing, maybe even is moving effective too, just to be moving around, doing some walking?
Absolutely.
That's something you'd recommend to keep people?
Frequent breaks if you can, stretching, and then trying to walk around, or even, you know, just change your posture a little bit.
Perfect. Awesome. Well, we're going to take a quick break, so we'll be back in a couple of minutes to finish our conversation. Thank you for all the information thus far.
Thanks.
Up next, we're going to talk about some common back issues and how to treat them. We'll be right here after these messages. Stay tuned. Welcome back. We're continuing our conversation with Trapper Hogberg, who specializes in orthopedic spine surgery. Thanks again for joining us.
Thanks for having me.
Absolutely. So, Trapper, before the break, we talked about some general spine health and back topics. I'd like to get more specific now about some more specific medical conditions. If we could maybe talk about herniated discs, what is it and what are the symptoms?
Sure. A herniated disc or a slip disc or a ruptured disc are all terms that people kind of use. They're most of the time the same thing. What that means is the inner portion of the disc has ruptured the outer portion of the disc, and it kind of comes out into the spaces in between the bones. And this can sometimes push on the nerves that exit in that area, and it can cause some what we call radiculopathy or shooting pains. In the neck, it can go down the arms. In the legs, it can go down all the way down into the toes. Depending if it's on the right side or the left side, it can affect different extremities. Rarely does it ever go into the face because there are no nerves that innervate the face from the neck.
Perfect. So what is the best way to avoid a herniated disc?
Well, the most common place of herniated disc is in the lumbar spine, because again, that carries most of our weight. So if you lift with proper posture, using your legs, and trying to never twist if you're lifting heavy weights. Also, be cognizant of how much you're lifting.
Thank you. So degenerative disc disease, or DJD, we all hear that term used quite often. Can you talk about that, and what is that? Sure.
That's when those discs that act as the shock absorbers in our spine, they start to lose moisture over time, and as we get older. This can start to cause the bones to rub together and can cause what we call axial back pain. That's the pain that you can point to in your back. Odds are, if you're around the age of 50 and experiencing back pain, you have some degenerative disc disease, which is causing that pain.
So can you talk to us about how that's diagnosed, firstly, and then how it's treated?
Sure. There's two separate types of pain. Is the axial that you can point to, and the radicular pain that goes down an extremity. Most of the time, talking to your physician and telling them, what type of pain you're having, if you're having numbness or tingling or anything along the lines of that. Most of the time, they'll order an X-ray, and then occasionally an MRI will be needed.
Okay. So osteoporosis, of course, something that does definitely affect people as they age, and even younger people sometimes, depending upon disease states. Can you talk about how that can impact the spine?
Sure. Just like any other bone, they're made up of calcium, and they have a structure to them. As we get older, you start to lose some of the integrity of the bone. They shrink down, and you lose some of the structure of the bone, which can cause the bones to not only shrink, but occasionally fracture. It is very common for elderly women, when they're in their 80s, about 40% of women will end up with some type of fracture in their back.
So how is it treated? How is osteoporosis treated then?
Well, one is trying to never get to the point where you have a fracture. Treating osteoporosis can be as simple as calcium or vitamin D, or it can go up to bisphosphonates or any other medications that your doctor might prescribe. DEXA scan is usually warranted to look at your bone health.
Okay. So if someone's experiencing pain, numbness, or tingling from a back injury and it travels down to their arms and legs, like you've talked about before, what would you recommend? What should they do?
Well, it depends. You know, there's multiple levels. You can have small incidences where you just feel an occasional tingle, but if it gets to the point where it's affecting your quality of life, you're getting weakness, you're tripping, falling, or especially if you're having bowel or bladder changes, you know, things that are significantly weakening, you should be seen sooner than later.
So can we talk about neck sprains, or we also hear it called whiplash, and what are the treatments for this condition? How does it commonly happen, you know, and what do people do for that?
Sure. Whiplash is a neck strain, usually the posterior musculature of the cervical spine. It's usually from a forward motion, which causes these muscles to almost rip and tear a little bit. This can be various degrees. You know, the significant ones can cause a fracture, and then the minor ones can be more of a muscular tear, which can cause quite a bit of pain. Most of these can be treated with formal physical therapy, medication, warm heat, and rest.
And in the whole tear situation, I assume, is surgery ever an option for that? It
can be. It depends to the severity. Most of the time, if it's an unstable fracture of the neck, that will require surgery, or if there's some kind of radiculopathy or what we call myelopathy, which is paralysis or change of the muscles or fingers, that can certainly require surgery.
Okay. So lastly, what is sacroiliac joint dysfunction? We've heard that term, I think, often. And what are the treatments for that condition specifically?
Sure. About 15% of low back pain can be attributed to the SI joints.
Okay.
Down a little bit lower than the lower back. It's where the pelvis attaches to the spine, and the SI joints, they actually act as somewhat of absorbers, but a lot of transfer of power goes through this joint. This dysfunction, like any other joint in your body, can cause a little bit of arthritis or sliding. It can cause significant pain. It's a difficult problem to diagnose, but most of the time is treated conservatively with formal physical therapy, occasionally injections and medication.
Okay. So a lot of great information you've shared with us today. Thank you for doing that. Is there anything in general you would like to say to our viewers just about maintaining spine health? If you had some great words of wisdom just in closing, what would you recommend, you know?
Absolutely. I think just staying active, lifting with proper mechanics. Rarely is back surgery warranted for back pain or anything along the lines of that. So rarely are we seeing surgery. When people show up to my office, a very small percentage of people are sent to an orthopedic surgeon that needs an operation. Most of the time, these things can be taken care of with, diet, activity modification, physical therapy. Warm heat, yoga, Pilates are also great things to do for back pain.
Heard motion is lotion, so that
Absolutely.
certainly reiterates that. Well, thank you so much for being here, Trapper. I really appreciate it.
Thanks for having me.
Absolutely. So up next, what can you do to strengthen your back and have a healthier spine? We'll show you some simple stretches and exercises to support spine health right after these messages. Don't go away. Welcome back to Healthy Living for Life. We're joined now by Tori Widowick, who is a physical therapist. Tori's going to show us some great exercises to strengthen and stretch the spine. Hi Tori, thanks for joining us.
Thank you for having me.
You're not a stranger to the show, you've been on before, so thank you.
I have.
Yes, so before we get into the demonstration this morning, could you tell us a little bit about why it's important to exercise your back and how a healthy spine is important to overall health?
So your spine, if you want to think about it, and Trapper talked about kind of the foundation of our body. Our spine, if we don't have it, we're falling down. So it's really important to keep the mobility, keep it strong, and keep it flexible so that we're able to do what we want to do in our functional daily activities.
Makes complete sense. So, I know often people injure their back while lifting things. We talked about this with Trapper, of course, and what do you need to keep in mind when lifting to protect your back? What are the important concepts there?
Yeah, this is really important, especially because right now people are shoveling snow, even though we don't have any right now.
Yes,
but
right.
You got to be careful of your back. When we're lifting anything, if it's really heavy, obviously ask for help if you feel like you can't do it on your own. But if you can have an object next to your center of mass or closer to your body, so you're not lifting from way out here, bringing it closer is the most important thing too, because that takes less stress off your back. And then what we talk about in physical therapy is hip hinging. And I talked about this a little bit before about how you need to make sure that you're hinging from your hips and not from your back. So when you're lifting, you should never feel any pain in your back. It should just be from your hips. So if you're feeling that when you're lifting, you're probably arching your back a little bit. So making sure you're sticking your butt back and your knees aren't going over your toes, and you're lifting from your center of mass and using your buttocks strength and your hamstring and your quads to pick something up versus your back.
That makes complete sense. And I guess along those same lines, in terms of like twisting while you're lifting, I mean, I'm assuming it's very important not to be at an angle or anything like that, like straight on.
Oh, definitely. And especially if you have osteoporosis, any of those end range twisting and a lot of extension or flexion forward can put you at higher risk for compression fractures, which is what Trapper talked about too.
Sure.
So being aware of that as well.
Okay. So let's get into some stretches and exercises. I'm glad you came prepared to do some show and tell today. So let's look at a couple stretches first for a strong and healthy back. That'd be awesome.
Perfect.
Thank
Okay.
you.
So most of us, we usually work at a desk, we're on our phones, we're typing. So a lot of us get a lot of this forward shoulder and head position.
Yes.
And so I see that in a lot of my patients sitting like this. And I even feel myself doing it at times too.
Yes.
So one of the important, like a flexibility or range of motion stretch that you could do for your thoracic spine is actually taking a chair, kind of like this one that has a hard back or no rolly wheels. I don't want you rolling away when you're doing this. But you can either put your hands behind your head in this position here, if your shoulders allow. But if not, you can cross here. And what you're going to do is just a gentle little back bend until you feel a good stretch in the back and then in the front part of your chest here too. Because when your pecs get really tight, they pull on the thoracic spine, which is that middle part of your back.
Sure.
That a lot of us get that back pain. So if you can work on getting that range of motion and hanging out in that end range for a little bit and then coming forward, you can help improve that back mobility and then stretch it out a little bit too.
Excellent.
So I would do about maybe 10 repetitions and then take a break with that one.
And yeah, how often during the day would you recommend somebody do that?
Well, they say you should do it at least every 45 to an hour. If you're sitting at your desk, you should do it pretty often.
Okay.
Because it only takes 15 minutes to get an upper trap little knot that a lot of us have if we're in static sitting for a long time. So if you can improve that, you get less neck pain and back pain with that too.
Makes complete sense.
Perfect. So then there's another exercise I'm going to show you where you can bend forward. So be careful if you have osteoporosis or something that you're concerned about. Obviously ask your doctor, your physical therapist, if this is okay for you to do. But you would reach forward towards your toes here, and you would just kind of drape your head down and just let your body relax. When you do that, the muscles along your spine go into a nice good stretch. And we say hold it for about 30 seconds to 45 seconds to get that ultimate stretch that you need. And then you can play around with it a little bit. You can kind of reach over to the other side and get that nice lat stretch, which comes all the way down to your hip, and then go the other way as well. So kind of play around it, listen to your body. Your body is going to tell you if it likes it. If it's painful and sharp, obviously back off a little bit and reset. Awesome. So that's a good one for a desk stretch.
Perfect.
The other one you could do for a standing stretch is what we call like an L stretch. So at home, if you have a counter that's about this height, or if you want to use your sink or something that you can grab onto so that it doesn't roll away or you fall backwards. But this one's going to get not only the neck, the middle part of the back, and then the low part of the back as well. So you would grab onto that sink and you would take your hips back where you feel pretty comfortable, and you're going to lean forward here and just let your head hang and hold your stretch. Again, this shouldn't be painful. It should be comfortable and tolerable for you as well. So
excellent, thank you.
Yeah.
So how about a couple of simple exercises that folks can do at home to help strengthen their backs?
Perfect. So posture's huge.
Yes.
You just talked about that as I'm sitting here.
Yes.
So a really easy thing you can do at your desk for those 35 to 45 minutes, if you're sitting there and you feel a little tight, is to work on some postural strengthening. So you can come up with your upper traps, then you can sneak back and pull them together, your shoulder blades, and then sink them down. and then hold that for about 3 seconds, and then release. Just doing that little bit of motion helps reset our shoulder blades and tells them to start firing to take pressure off our back. So I do about 10 repetitions throughout the day and just see if I can work on my posture a little bit better with those too.
Awesome.
So that's something simple.
Okay.
You could also kind of pretend like you're rowing. You can sit upright when you're doing this too, and you can just take your arms back and squeeze those shoulder blades. Try not to do this and squeeze back, because that just activates those upper neck muscles where we can get a lot of neck pain too.
Sure.
So make sure they're down and then row back and hold those ones as well. So that can help with the upper back strength for those
Awesome.
ones.
Perfect.
Yes. So for standing though, so say you're not sitting, for standing what you could do is you could do a standing plank.
Okay.
So if you have really bad wrists, you could do it on your forearms too.
Okay.
But if for demonstration, I'll just do it this way. What you could do is put your feet back a little bit further so you feel like you're leaning into either a counter or a table, or if you have a chair that doesn't have wheels, that's pretty stable. And your feet are shoulder width apart. That's the most important part. And that your hands are about shoulder width apart as well. So with this, you want to make sure that you're using a lot of your core muscles. So you want to think about taking your belly button to your spine and really engaging those muscles as you hold your body weight up to engage not only your core and your back, but also your buttock region,
Sure.
which helps with lifting.
Perfect.
So there you go.
Awesome.
That would be another one.
Awesome.
Yeah.
Thank you, Tori. Thank you so much. Those are extremely helpful.
You're welcome.
And thank you for being here. I really, really appreciate it. You always have great information to share. It's a pleasure.
Well, thank you.
Absolutely. I also want to thank Trapper for coming on our show. I hope you learned about spine health and enjoyed our show this week. See you next week. And in the meantime, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.